pleased with the study and had no reason to expect anything else. Don't forget many of our vaccines are given to young children, and there was no particular reason to think the immunology would be fundamentally different in them.
Now, what are the implications of this? I mean, some European countries have begun vaccinating 12 to 15-year-olds. In the UK, only after some pretty long, prolonged debate. What are the benefits, do you think, of vaccinating children even younger?
Yeah, I think the fact that different countries have gone down slightly different roads at a slightly different pace shows that in terms of the scientific evidence database, we've got into a more nuanced phase in this discussion. So, everybody will have heard the different sides of the argument. From my point of view, I think that children are susceptible to this virus. Don't forget it, the argument moves on so fast. Now that we're in a time of Delta, the age range has shifted down, and many hospitals have many children and adolescents in them. So children are affected. They do pay a price for it. 1 in 200 of them who get infected get hospitalized. So to me, the benefits are clear.
And what about the wider argument, though, in terms of if we're talking about sharing doses? There are more and more complaints that poorer countries don't have enough to be jabbing even elderly people. Should we be looking in richer countries to vaccinate even younger children?
No, I think there's a good and important and valid arguments that we need to have. We need to have them at a high level and a serious level. In other words, at an intergovernmental level. I'd like to see some mathematical modelling to really bottom out whether, how we get maximum bang for our buck in terms of using the vaccines globally, rather than giving third doses to adults in wealthy countries, or indeed doses to children. I suspect the benefits would be greater by sharing them out, as long as we have some machinery for doing that sharing.
And where do you think this study will go now as far as vaccinating younger children is concerned, given the debates that there have been? The study's going to be passed to the health regulators. Do you see that it could be a runner?
I think it could be a runner. As I said, I think the debates get harder and harder as we get into more difficult territory. Obviously I'm speaking to you from the UK, which was slightly out of line with other countries because we jumped very readily into boosters for adults and much less readily into vaccination for children, whereas many other countries were the other way around, which doesn't mean that, some countries are more stupid than others. It just means that these are much more difficult decisions now. And I think those difficulties will go on, but we have to have those decisions and have them led by the data.